I'm Reverend Olufolake Ike, and I want to talk to you about something I tagged escape. You need to escape for your children to escape. Mothers impact their children physically, emotionally, but also psychologically, and by the choices they make in life. A mother who has the best interest of her child at heart must escape from an environment that puts that child in danger. Escape mentally, emotionally, or even physically if need be. I love to educate women on how to escape mentally, because if you cannot escape mentally, you can't even escape emotionally or physically. To escape, the first step is a paradigm shift from what you think it is to what it should be. In this day and time, there is no such thing as I don't have a choice. Let me start by psychoeducating you to begin the process of your mental escape. In their study, Harold, Aitken, and Shelton came to a conclusion that marital relationship plays a very vital role in determining the academic performance of the children. According to Rodman, in a family experiencing marital conflict, it is difficult for children to find a sense of security because experience has shown them that what seemed to be stable and good could fall into pieces, leaving these children empty. This emptiness may result in a withdrawn attitude or in an insecure attachment style. Strife, bitterness, and unhappiness make an environment toxic for a child. Oppositional defiant disorder, or ODD, characterized by difficulties in educational setting, always arguing and fighting, lack of friends, refusing to follow rules, annoying and blaming others, destroying relationships, unwilling to compromise, spiteful and seeking revenge, blatant and repeated disobedience, continuous feeling of frustration, problems concentrating, loss of self-esteem, persistent negative and feeling of annoyance is developed in some children as a result of divorce, absence of parental supervision, abuse, neglect, family instability, financial issues, frequent change of caretakers, parents with mood disorder, parents with substance use disorder, parents with conduct disorder, that is, parents who are unruly in public or at home, and so on. If you observe a child exhibiting 4 out of these problematic behaviors that I've listed for the past 6 months, and the child has been vindictive maybe twice in the last 6 months, it is likely to be ODD. One of the treatments for ODD is parent management training. In therapy, that child is not the identified patient. Studies also show that adverse outcomes that result from exposure of a child to domestic violence results in an increased risk of psychological, social, emotional, and behavioral problems, including mood and anxiety disorders, PTSD, substance abuse, and school-related problems in children. What am I saying? The very children parents claim to protect by enduring and enabling codependency are the very victims. I know that the society makes domestic violence and alcoholism something private, and we mustn't say it outside. But in reality, it is a social matter because the children who suffer from the adverse effects of these issues become school bullies, street thugs, and they are not able to learn much in school, thereby making them into people that cannot even benefit the society. Who is to blame? Is it the father who suffers from this mental and emotional disorder, or the mother who chose to cover up for him at the detriment of innocent children she claims to love, to a point of enabling the abuse just to escape the shame? I know that in certain situations it is vice versa. It's the women who are under this influence and the men are trying to rescue. Whatever parent is saying needs to rescue the children.